My name is Rohan Galloway-Dawkins. I'm the Chief Product Officer for Versaterm. Really, what we're looking at is an ecosystem of end-to-end software, really focused on public safety and all the workflows and use cases that are necessary to respond to incidents and help the community. So we've got a couple of areas of interest that we're really focusing on this year at IACP. One of them is artificial intelligence. And really, when we think about artificial intelligence, first we want to focus on the problem that we're solving. So our implementation of artificial intelligence at the show at IACP is focused on community engagement and automating some of those lower priority but high volume workflows. So we've got two solutions. One, CallTriage, focused on non-emergency service calls coming into the PSAP and getting those people responses faster. It gets the community responses faster. It also takes some of that load for lower priority calls off of the PSAP so that they can have more time to spend on those higher priority calls that are coming in. The other use case that we really focus on is non-emergency service reporting. Right? So one, meeting people where they are. We support 36 different languages, and we allow people to describe their need in their own words. It's not a call tree, it's not a specific form that has to be filled out. We have an investigative conversation back and forth to leverage that technology to meet people where they are and to have a more effective outcome. So for the community, they get a better customer service response. For the agency, we're taking a lot of that volume, a lot of that overhead that they would have had to spend investigating and documenting these non-emergency service requests, take that off of their plate and provide them more time to focus on those other higher priority missions. Another one that we're really engaged in or really focused on is health and wellness. When it comes to public safety, the mental health and wellness of first responders is something that we collectively don't do enough to support. So our mind-based solution is focused on a peer support methodology and taking that peer support program and making it the most effective that it can be. First, making sure that people don't fall through the cracks. So we automate some of that need for service by connecting into CAD records or other enterprise level operational solutions to understand the different types of incidents and responses that first responders are supporting. Based on the severity and the number of those incidents that they're responding to, we'll go ahead and trigger off peer support check-ins based on that activity and the severity. Again, make sure that one, we haven't let anybody fall through the cracks. We follow up on that to make sure that peer support check-in actually occurs. Make sure that people are getting the support that they need and not just falling through the cracks and not being supported.